Okay, we started this video. This is our video that's going to just like keep an eye on the room. And then Haley's got her video right now. Let's just start that one. Oh yeah, there's nothing on the front or back.
No, that's a photo.
Okay.
Okay. See?
Okay. So she's scanning the room. She's gonna scan the whole room right now. All I have is like my equipment and stuff right here that I'm gonna use for my video.
That's my equipment right there.
Do the ceilings, the floor. Oh, here's all our crap in our bags.
There's you.
Floor.
Ceiling.
Okay. So now we're gonna start. Okay. So I've checked the chart. My patient, Barbara, she needs a Foley catheter and an NG tube and then a urine sample, and then she's getting better. So we're gonna take those things out for her. So that's what we're doing today. Okay, so I've gathered my supplies. I've checked the MIR. I know what the doctor needs me to do. And so here I go. Okay. So I'm coming in, close the door for privacy. Hi, my name is Sam. I'm gonna be your nurse today. Can you give me your name and birthday? Awesome, Barbara. Okay. So Barbara, do you know what we're doing today? All right, we are going to do a catheter first. It's going to help kind of drain your bladder. And we're also going to get a specimen sample later. Are you in any pain, Barbara? No? Okay, great. And do you have any allergies? Not that you know of? Okay, great. So that matches up with the MAR. You don't have any allergies, so we're just going to move forward then. Have you ever had a catheter before? No. Okay, so I'm going to walk you through everything step by step as we do this, all right? So I'm going to wash my hands first. Got my hands washed. I'm going to throw on some gloves, and then we'll go ahead and get started. So with the Foley catheter, I will be inserting it into the urethra. And so if at any point you are not comfortable, I want you to stop me. We're going to go slow. I'm going to explain the whole process step by step so that you are comfortable the whole time, okay? So I'm going to come here over on this side. And I'm actually going to grab my own gloves because I know that these ones aren't great for me. So, before we get started, I'm going to go ahead and raise the bed. And for now, I'm just going to keep you positioned like this, all right? I'm going to have you laying back. Okay. So I'm going to bring the blanket down. Now, Barbara, can you go ahead and we're going to have you open your legs as best you can and uncover you now, okay? Is that all right? Okay. So if you can, yep, good. We're going to do both legs. Open the best. Okay. So, got your legs open, great. Okay. Nice and set. Are you comfortable? Okay, great. So now what I'm going to do, so I'm going to dispose of these gloves. I'm going to do my hand hygiene. So I'm going to throw these away in my garbage can. So first, this is a sterile procedure. So it's very important that as best you can, we're not moving around. So we're going to have like a sterile flow. So everything is going to be sterile. This is going to help prevent infection. And so while I'm doing the procedure, if you need me to stop, let me know to stop. That way I'm not doing anything that's going to cause you to move and cause potential risk for infection, okay? Okay, great. So first I'm going to get my gloves on, my sterile gloves. I'm going to open these up, throw that in the garbage. Okay, so I've got my sterile field, got my 1-inch diameter. Okay, so I'm going to get this glove on first. Okay.
You've got to start over. You can't put on sterile gloves before you open your unsterile package.
Shit.
And you explicitly need to, I didn't say anything because I thought your mind covered it, but you need to explicitly say, do I have your consent for this?
Okay. to my gloves now. Shoot. Okay.
I was still just use my gloves. I have nothing to wear.
Yeah.
I was just
Okay.
like, what's going on?
We're not stopping this video though. I'm getting new gloves.
You just want to use mine that are open?
I think I have more. Oh yeah, I'll just use yours. Okay.
Well, don't rip mine. Start it over.
Okay.
I was trying to slow this, but my butt kept falling off because my coat was on.
Okay, so this is still recording, so everything you say. Okay. Now I'm flabbergasted. Okay, starting over. Oh, frick.
And deleting that video.
Okay. Bring it around. I didn't forget anything before that, right?
Okay. It was just like explicit consent and then
Okay.
don't put on sterile gloves before you open the package.
Sheesh, what am I thinking? Okay. Okay. I'm ready.
I gotta do I need to do sweep of the room again?
No, because we kept that going all the time.
Okay.
Okay.
Yep.
Okay, so I've got all my equipment that I need. We've done a sweep of the room. I've checked the MER. I know exactly what I need to do with my patient. She's going to get a Foley catheter, a urine sample, and NG tube. So we will. So I know what I need to do and who my patient is, and I'm going to go in. Hi, my name is Dee. I'm going to be your nurse today. Can I get your name and birthday? Great, Barbara. All right. So what we're doing today, we're doing a Foley catheter. It's going to help drain your bladder for right now. Okay, wash my hands. Let me get some gloves on. Now with a Foley catheter, have you ever had one before? No? Okay. So I'm going to go step by step every little part of this with you. And Barbara, are you in any pain today? No? Okay. And do you know if you have any allergies? No allergies. Okay, that's great. So with the Foley catheter, it is inserted into the urethra, so down in your vaginal area. And so I want to make sure that I have your full consent to do this. I do? Okay, great. And then if at any point you're uncomfortable or you're in pain or there's something going on, I want you to make sure you let me know, okay? And I'm just going to step by step let you know everything that we're doing. Okay? Sounds good? Awesome. Okay, so first, I'm just going to get my stuff set up over here. Throw this in my hypothetical garbage. Okay. So first I'm just going to get you set up, okay? So I'm going to get the bed raised, bring you up to my level. Okay. I'm going to draw the sheet down, and then just to confirm, I do have your consent, correct? Okay, great. So, what I'm going to have you, I'm going to lift up this. And in order to do this properly, we're going to have you bring your legs up kind of like frog legs. Yeah, just like that. Perfect. Okay, we're going to do both sides. Awesome. And then I do need to let you know that we are going to be working with a sterile field. And so the best you can, I need to make sure that you don't move around. We don't want to mess up that sterile field. We're going to do the best we can to just prevent any sort of infection. So if it's hurting or if something's going on, just let me know so that I can stop what I'm doing. And we can adjust what we need to, but that way you can stay as still as you can, okay? Does that sound good? Okay, great. So, first I've got my wipes, my pretend wipes. Crap, I'm gonna grab some wipes over here. These are from the facility. They are wipes that we are able to use them on the peri area. So first, I'm just going to kind of get you cleaned up. So I'm going to go down front to back using several different wipes, making sure I have the insides wiped. I'm going to get the legs clean, so we're cleaning all this area, just getting like a really clean area. So I'm using several different wipes, making sure that I'm not going over the same area with the dirty part of the wipe, that I'm using new clean wipes every time. So we've got you cleaned up, you're good to go. Is that okay? Is everything still okay? Awesome. Okay, so now I'm going to dispose of my gloves. of them in the garbage. I'm going to get this open first. This is all the equipment I'm going to be using, okay? And if you have questions about any of it, just let me know. So everything on this sheet is sterile, so I can't touch it at all. Okay, now I'm going to get my gloves on. And I have a 1-inch diameter. And I haven't touched this part yet, so this glove is still okay. I haven't touched the inside yet. And if it wouldn't have been, I would have grabbed a new pair of gloves and started over. There we go. Okay. So I don't want to touch the outside of that to my sterile film. Okay, so first I'm going to get my glove on. Okay, good to go. This I'm going to throw away. Okay, don't need these. Alright, so I'm just going to get a few things set up, okay? Okay, so first I'm going to lay down my cloth. This is going to go underneath you. I've got the shiny side down. I'm going to tuck it under. Remaining sterile all the way, not touching anything. Okay, and then this is just going to come just right over the top, okay? You still doing okay? All right, good. Okay, just right over there. Okay, perfect. Just going to get a few other things set up. Okay, so I'm going to put my lube just right here in the tray. Going to attach my syringe. Right here to that. Okay. Luckily, it fell in my sterile field, so everything is totally fine. I'm going to put my syringe back on. Okay, now that all that is good, this is going in the garbage. I'm going to take my cleansing wipes to clean. This hand will be unsterile after this, so I'm going to carefully, it's still sterile filled, so I'm just going to bring it this way. Okay, so this hand will become unsterile. I'm going to go here, pull it apart. So it would be pulling apart the lips. I'm going to take my first one and go down the side. We're going front to back, discard. Second one, down, discard. Third one, right down the center, getting it nice and clean. And I'm going to leave my hand like this, not let it close up. I'm going to grab my lubricated catheter and my kit. Okay. All right, Barbara, is everything still okay? Okay, so I'm going to take the tip of this. It's been lubricated to help with pain, so it slides in a little easier. Okay, so it might feel a little bit cold, a little bit of pressure. Let me know if it hurts. Let me know if you need to stop. Okay? Is everything still okay? All right, here we go. So I'm going to insert the catheter now. Okay. Good. Still feeling okay? No pain? Okay, good. All right. Now I've got urine. You can see the urine, so that means we're in. So I'm going to go just a couple more inches in. Okay. Perfect. Now I'm going to stabilize the catheter while I blow up the balloon. to the side of the leg. This is going to go below and put on the bed frame a non-moving spot. Let's see. I didn't bring any tape in here. Okay, so this is secured right here, wrapped around Velcroed. All right, let's go ahead. You can put your legs back down now. And then because of the lubrication, I'm gonna clean you up just a little bit, okay? So, my hands aren't too dirty, so I'm gonna go ahead and just get my wipes. And then wipe around again, side, throw it away, new wipe, this side, throw it away. And then down around this, and hold this, make sure you clean it, that it's nice and cleaned up. Okay, good to go? Awesome. I'm gonna cover you up. Now if you had had your catheter for a while and we were needing to do a sample, what I would do is I would be clipping this, and we're going to clamp that for 15 to 30 minutes, and then I would come back in and check. So I've got that clamped. We're gonna cover up. Okay, take my gloves off. And then I would put these away, hand hygiene, get some new gloves on, get all this taken away, thrown in the garbage. Reposition. Did you want to sit up? I can sit you up. Lower your bed back down. And you said you want to sit up a little bit? Okay. We're sitting up a little. Okay. Perfect. So now I'm going to leave the room. Everything looks good. I'm coming back in to get a sample. So I'm going to clean this stuff up real quick. I'll have my sample table ready. Okay, I'm going to use this for the sample. Okay, so I've left the room. I know I need to get a sample now. She's been clamped for like 15 to 30 minutes. So I'm going to come back in, knock on the door. Hi, Barbara, it's me again. Because I disclosed her name, I'm going to check for other identifiers. So Barbara, what's your birthday for me? Okay, great. And then what is your home address? Awesome. I would also check her wristband, make sure it's her. Okay, great. So Barbara, while I wash my hands and put my gloves on, I am going to collect a sample from your catheter. It's just going to be real quick and easy. Okay, so I'm going to glove up. And then I've got my sample cup. And then my empty syringe. That would be packaged and clean, because for this sample we need it to be very, very clean. I've got my biohazard bag that I'm going to need. So in order to do that, I'm going to just lay this here. Okay, so I'm just going to go ahead and lift up here. And I'm just going to take it from right here, okay? So, I've got my syringe. I'm going to open up my specimen container first. Be very careful not to contaminate it in any way. I've got my alcohol swab that I had ready. And with my alcohol swab, I'm going to clean this area that I'm going to be pulling from. I'm going to clean it really good. Okay. And then I will have my syringe out of my fresh package so that it is still sterile. Click it in. And I'm going to be pulling 5 to 10 milliliters, at least 5. Preferably 10 if we can get it. Okay. Pull it off very, very carefully. I want to make sure that I get it directly into the specimen cup. Okay. And then this will be going in like a biohazard trash can because of the urine. I'm going to very carefully put my lid on. So this has been put in a biohazard trash can. It needs to be labeled with their name, date, room number, my initials, anything, the time, specifically name, date, and time, but anything else that the facility's policy needs, into a biohazard bag, and then we will be submitting it to the labs for what they like. All right, Barbara, I'm just gonna unclamp here for you. Make sure you're comfortable. Okay, awesome. You good to go? Is there anything I can get for you? Okay, great. Well, I'll see you in a little while then. Okay. For the last thing I need to do is I have an order to remove the catheter. So, for the sake of saving gloves, I think we might have enough gloves. But I had removed my gloves. Well, okay, I'll just show you. It should be okay. Okay, so now I know that I need to remove the catheter. So, I'm going to have my materials. I think I just need a syringe. A syringe. Okay. So I'd be removing the catheter. I know that I need a syringe to deflate it. So again, I've checked my MR. I know what I need to do. Knock on the door. Hello, it's me again. My name's Dee. Can I get your name and birthday? Okay, great, Barbara. So we get to remove your Foley catheter today. If you have any questions about that, just let me know. So you no longer need it, so we're going to head and get it out for you, okay? Perfect. So I'm going to wash my hands, put on some gloves. I've got this up in here. I've got my packaged syringe that will deflate it, and then a towel I'm going to put underneath her. Okay. Going to bring my tray over. Okay, so again, this is packaged, so putting it down here isn't going to contaminate it or anything. Okay, Barbara. So first, I'm just going to lay you back just a little, okay? This is going to help make you more comfortable, all right? And again, if you're uncomfortable, if it hurts, anything like that, go ahead and let me know, okay? And I will stop right away. Okay. So, I'm going to have you open your legs again just a little bit. Perfect, just like that. I'm going to inspect, make sure everything looks okay, that there's no, like, irritation, swelling, things like that. Make sure that it looks okay so that we don't have any issues when we're removing the catheter. Okay, first I want to empty my bag, and so I would have my specimen cup, or my, I guess just like my cup to empty. Now I have my clean cloth down here, lay it, empty the bag, set it on a flat surface, and then I'm going to measure my output, and I'm going to document my output before I remove it. Okay, so once I have removed it, go ahead and get this, unpackage my clean new syringe. Okay, I'm going to go ahead and deflate your balloon, okay? All right. There we go. Perfect. Okay. Go ahead and take a deep breath for me. It might be a little uncomfortable, but I'm going to get it out, okay? Perfect. Okay, you did awesome. Now I'm going to get this and throw it away in the biohazard. Both of these are me throwing away in biohazard because of the urine, so that's going to be tossed. What I forgot to do that I would have done is I would have actually laid this towel underneath her first. And that would be to catch any drippage, any urine, anything like that. So that would have been laid down first before I took out the catheter. So, done that, everything looks good. Before I do anything else, I'm going to actually clean you up just in case there was anything that got on you. So I'm going to, with new wipes, go down the side, new wipe right down the front, and then make sure it's cleaned up. All right, wasn't too bad, right? You did awesome. Okay, so now I'm going to I'm going to cover you up. And then you said you wanted to sit back up, right? Okay, I'll go ahead and get you sat up then. Okay. Perfect. Barbara, just make sure it's still you. Okay, like I talked about, we're gonna place an NG tube. And have you ever had an NG tube before? Okay, so it's a nasogastric tube, and so what it's gonna do is it's gonna go up through your nose, down into your stomach. It can be used for like decompression, for like suction or feeding, things like that, okay? So I'm gonna go ahead, bring my stuff over here again. When I came in, when I identified, for the sake of gloves, because we're getting super low, I came in, I hand hygiene, and I put new gloves on. So these are fresh new gloves that I put on, okay? All right, Barbara, so to get started, I'm gonna go ahead, first I'm gonna sit you up, okay? 45-degree angle. Okay, there we go. Are you comfortable? Okay, great. So I'm gonna get my things set up. So in order to place the tube, I've got my cup of water and my straw for her. I've got my tape to secure it, some lubrication to help it go down. So I'm gonna open up my package. I've got a towel, I'm just gonna lay it right here for you, okay? That way we don't get anything on your clothes. Okay, so we've got the towel. I'm going to measure for the length of tube that I need for it to be inserted. Okay, so in order to measure, first I'm going to go from the nose to her ear, and then from there down to the bottom of the sternum, okay, right here. So I've got about 51. I'm going to mark this with my marker so that I know how far I'm going down. Okay, so I've got that marked. And then, Barbara, have you had any surgeries or head traumas? No, you haven't. Okay, great. So just want to be extra careful of that. So, I'm going to change my gloves, take off my old gloves, and put new fresh gloves on to do the procedure. So first, I'm going to get my tape set up. Just kind of get this ready to go. Okay. I'll put this right here, okay? All right. I'm going to move this pillow. It's going to help with the angle we want for your head to be at. Okay. There we go. Okay. Now I'm going to get the lubrication on the tube. Okay. Okay, Barbara. I've got this cup of water and straw for you, okay? Just have you take little drinks of it while we do this, okay? Okay. If you're feeling any pain, it's uncomfortable, just let me know. I'll go slow, and I can stop if it hurts. You just tell me to stop, okay? So we're doing it very carefully and slowly. Okay? So I'm going in a little bit cold. Yeah, that's it. Good job. You're doing awesome. Awesome. Okay. Okay. Go ahead and move your head a little bit forward, chin down. That's going to help. That's great. You're doing so good. Awesome. We're almost there. You doing okay still? Okay. So she's still able to hum and talk or make noises, and there's no signs of cyanosis. So I have to my mark right here. Okay, good. Is that okay? Is that still comfortable? I mean, as comfortable as it can be? Okay. So now what I'm going to do is I'm going to take my syringe, the syringe that I brought for the aspartating. There it is. Okay, so we'll check with an x-ray, but I do want to aspirate first and test for the pH, make sure it's in the stomach. So I'm able to do that, and I check my strip. I am in fact in the stomach. I've got the pH. Okay. And I did slightly secure this for now. Okay. Great. Okay. so now that we do have the pH, I am going to mark where it's at, so I'm going to take my marker and mark right where it's at. Okay, awesome. Now I'm going to take my gloves off, call for an x-ray. Hello, this is Dee. I've got Barbara here. I just placed an NG tube. We need an x-ray stat. Awesome, thank you so much. Okay, and I'm going to put my gloves back on. My gloves are back on. Okay, so I'm going to make sure that I get a good barrier cream in place around her nose. I'm going to move this out of the way now, or I'm going to actually keep this. So with my new gloves, I have barrier cream on my hands, so I'm actually going to take them off again, put new gloves, do some oral care, some mouth oral hygiene, get her taken care of. I've got this that is pinned. I would take some tape and a safety pin, and this would be pinned to her clothes, just to her gown, right here, to help it stay secure. Take this away. If it's what was ordered, I would be hooking it up to our suction, which is going to be low, intermittent, or whatever the order calls for. Have this. Let's see. All right. Oh, there we go. Maybe. Okay, so this would be hooked up. If that's what the order called for, make sure she's comfortable. How are you feeling? Is there anything I can help? Is there any pain? Are you feeling okay? Okay, are you comfortable sitting like this, or do you want to be adjusted? No? Okay, great. So, I'm gonna, before I take my gloves off and wash my hands again, I'm gonna collect everything, throw it away, readjust, get her bed put back together. Okay, do you have any questions for me? No? Okay, sounds good. Well, I'll be back later with your medications. Okay, so the last thing I need to do is there's been an order to take her NG2 out, and so that's what I'm gonna do. And so I've checked, made sure that I've got everything I need, so I knock. Hello, it's Dee again. Can you confirm your name and birthday? Okay, great, Barbara. Just gonna wash my hands. Before my hand hygiene. All right, we get to take this NG tube out for you. Yeah, I know, I bet you're excited. Perfect, so let me just gather my supplies. Okay. So I've got my towel, that, okay. So let's get started. So first, I'm going to disconnect all of the equipment. So take this off, turn it off, take it off. I want to make sure if I've got fluid in here, I'm measuring the fluid. I'm going to lay my towel down. And Barbara is in a good position. Okay, and I'm taking off, I've unclipped it from here, from her clothes, and I'm pinching it off. And then I'm going to take this off your nose, okay? Try not to hurt you at all. Okay, so now I've got it pinched off. Now, I've got a basin here for you, and a tissue. So if you feel like, it's making you gag a little, throw up anything, I've got this for you. Okay, great. And then tissue as well, okay? Excuse me. And then I've got my rag as well. Okay, we're gonna go slow, so it doesn't hurt. And we're just gonna get this thing out of you, okay? Okay. I'm gonna hold it here. There we go. Good job. You're doing great. We're almost there. Doing so good. Good. All right, yeah, go ahead and cough. Awesome. I'm going to throw this away. Good. Awesome. We're all done. Okay, go ahead and take this from you. Get a wipe or a tissue. Kind of clean her up with my tissue. Let her clean herself up as well. And good. Cough it out. Take this away. Okay. hygiene. Make sure that Barbara's comfortable. Do you have any questions for me, Barbara? No? Okay, well you did so awesome. Took it like a champ. And if you need me, just go ahead and push your call light, okay? All right, you wanna stay sitting up? Yeah, okay. I'm just gonna lower you down just a little bit. Then give you your pillow back. Okay, great job today. And I'll see you back in a little bit.